Good evening, everyone, and welcome to the town hall. Certainly, I am your host for this evening, Jean-Claude Seno, and this town hall is part of a series of educational broadcasts on the upcoming legislative elections in September, which will occur during these unprecedented times of a health crisis that is disproportionately affecting minority and poor communities. In addition to the COVID 19 pandemic, the killing of George Floyd is certainly part of the actuality that we are so concerned about. There are so many other things because we are on the crossroad of so many issues that we are so concerned with. So, tonight's event, I will be the one hosting it instead of Angel, who was supposed to be here with you tonight, but unfortunately or unfortunately, I am the host that is going to be doing this together with other co-hosts. And I do see that we do have Marlene Amide, who is already on board together with us for tonight. We also have, is this?
Maria. Maria.
I want to make sure I pronounce it right. So, Amina Pilgrim?
No, Maria De Canto.
Oh, Maria the Contour. I'm sorry, darling. It's been a
Okay.
while since I haven't seen you in Brockton because I'm in Boston.
That's right.
And
That's
also, our guest for this evening, whose features just happens to be pinpointed. So let me just say good evening to you, ladies, who are the co-host. Why don't you guys go on point with your own introductions before we move along with the questionnaires?
Maria, you want to go?
Thank you. Sure. Good evening, everyone. Thanks for tuning in. I'm your co-host, Maria Ducanto, and I do fill in pretty quickly. So as Marlene would say, she had the pleasure of asking me, let's say yesterday, and I said, absolutely, because I know who the host was and what he stands for. And I said, right away, I would be happy to co-host. So thank you again, and glad to tune in, and we'll have some questions for you.
Well, thank you. As everyone knows, my name is Marlene Amidi. I'm one of the co-hosts of this town hall. So I have the pleasure and privilege to have a guest with us and to be on the panel with Maria, my dear friend, and Jean-Claude Sanon with my dear friend as well. So we will have a lively discussion with our guest. So he will have a chance to introduce himself. So welcome. Thank you.
Well,
Go
thank you.
ahead, sir.
Thank you. Thank you for hosting tonight, and I'm excited to be here with everyone. For people who don't know me, I am Dr. Robbie Goldstein. I am a physician. I'm an infectious disease doctor at Mass General Hospital in Boston, and I'm running to be the next representative for Congress in the 8th Congressional District. And I got into this race back in November 2019, and at that time really was very clear that I'm in this race to fight for access, equity, and opportunity for every person in every community across the district. Now that statement has taken on so much meaning over the past 4 months, 5 months, as we have addressed the COVID-19 crisis, as we have witnessed police brutality all across this country, as we as a nation have begun to reckon with racism and the institutional segregation that has existed for so many years. And I'm here to fight against that, to fight to bring an infectious disease doctor to Washington, to fight to bring a new perspective to Washington so that we can really address all of these issues and make sure that everyone has the ability to live a healthy life, no matter where they live across this district. So thank you for letting me join tonight, and I am excited to dive into the questions and the discussion part of the evening.
That's great. I see our host is off the screen. So
Yeah, well, he's back. He's back, darling. I'm so sorry. It's a man of many trades, and there are too many candidates in the city who is seeking for our help. So therefore, we are being bothered by many of them. Well, Mr. Goldstein, it is a pleasure, and we welcome you. And this evening, we're going to follow an amicable conversations together with you, and we will certainly expect, as the agenda is being proposed, with the timely fashion is candidate will have 2 minutes for opening statement, which you just done, 2 minutes for closing. The candidate will also have 2 minutes to answer each question. So let's move on along with the first questions. and I'm assuming the cause can also will have a chance also to at least to proceed with me within that frame of thoughts. First one is: do you support or oppose removing term limits on state senators and state representatives, and why?
I get asked this question a lot about term limits and whether or not we should institute term limits or remove term limits, or how we can best make sure that fresh perspectives can make it to the State House in Massachusetts or the House of Representatives down in Washington. I think term limits are one way to do that. And potentially that is something we have to think about. But I actually think much more importantly, we have to have a conversation about money in politics, because the amount of money that keeps incumbents in office really is what is blocking folks like me who are trying to bring a new perspective to government. I am fighting an uphill battle in this race. I am fighting against someone who has $1.5 million that he's been able to amass over 19 years being in office. That $1.5 million is in some ways an enormous barrier to me to even jump into this race and to be able to have a conversation about taking on such an entrenched incumbent. So I think we can certainly have a conversation about term limits, and I'm not opposed to that conversation. But I think more importantly and more pressing, we have to have a conversation about money in politics and how we can make sure that we decrease the influence of the very wealthy and the corporations and give everyone a voice in who their elected representative is.
Totally in agreement with you, and I would assume also after being into certain positions for too long, some of our representatives or some of our senators become kind of, should I say, losing track of the momentum of where they first started. And for us who happens to be coming from the foreign lands, we seem to think that they are there for life, so which is not a very good image at all. But anyhow, what is your opinion and solutions to the issue of starting school in the fall as it pertains to safety regarding COVID-19?
So just this morning, you guys might notice that my face is a little bit burnt, and it's because I was out at the steps of Boston City Hall with the Boston Teachers Union and the nurses in the schools all across the Boston School District, and nurses really from all across the Commonwealth. And we were out there demanding that nurses and educators have a seat at the table as we have this conversation about reopening schools. I do think that we can reopen schools in the Commonwealth. I do think that we can do it safely. But I think we can only do it safely if we invest where we need to invest. That means making sure that every school all across the Commonwealth has enough personal protective equipment, enough masks, making sure that every school has a plan around disinfecting school buses and nurses' offices and classrooms, and that every community has enough invested in public health so that we can actually listen to those people that are watching the data, watching where new cases are coming, watching what communities are most affected. And when we need to, transitioning from in-person school to the virtual classrooms that we had at the end of the last school year, and being able to go back and forth based on the data that are available. So I think we can do this. But what I'm nervous about is that I haven't seen the state government and the federal government invest in the way that it has to make sure that schools have all the resources they need to open fully in September.
We want to thank you for your answers. Ladies, anytime that you want to jump in and ask anything out of the list will be fine. Go ahead.
I think I'm going to segue to another line of questions. So, and then we can come back again on education, because I think Maria has a few questions on education as well. So, one question that I want to ask you, Robbie, it's about, the environment right now after George Floyd, and then what's going on in the country regarding the violence, regarding police brutality. So I just want to have your thought about defunding policing. So is that something that you are for? And if you are not, so what is your approach on that?
So I like so many other people, everyone in this country, have been watching what's been happening every single day. And also recognizing that this has been happening for decades. It just hasn't been playing out on TV every day. Mm-hmm. We need urgent police reform. We need to end the excessive use of force. We need to end qualified immunity. We need to make sure that people can get the medical attention they need whenever they're being detained. There's a lot of police reform that has to happen. But I also think we have to recognize that our streets are not safe right now. They're not safe for youth in many different communities all across Massachusetts and certainly across the district. And we have ways to invest in programs that will make our streets safer. Now, I think that that investment should go into counselors in schools, community programs that work with the survivors and victims of violence, making sure that we build up after-school programming and weekend programming and summer programming. I think we have evidence that says that makes our streets safer. I think we also have evidence that all the money we're pouring into the police departments across the country is not making our streets safer. Yeah. And so why would we keep pouring money into the police departments when we know it's not achieving what we want it to achieve? So I certainly think that in this year, when we're going to have real budget talks because of the shortfalls that are going to happen from COVID, we have to recognize that we're not going to be able to fund the police at the same level, but we have to fund schools. We have to fund those after-school programs. We have to fund the community programs because they're the things that work. So, that means we're going to have less money for the police.
Okay. So, because COVID, we're going to have less money for the police, or you, as a candidate, you support the defunding? Let's take the defunding. We are allocating the money of the police, some of the money for the police to other places else.
It's both, right? Certainly because of COVID, we have to do that. But even before COVID, this campaign was having a conversation about how we reallocate that funding for gun violence prevention from where it is in the police department and the criminal legal system and moving it into those community programs that actually work with survivors every single day, that actually make our streets safer. So this is about who I am as a candidate, about making sure money goes to the right place, that we legislate and budget our values and not just do what we've been doing for the past 5 decades simply because it's the thing that's been done.
Okay, so you mentioned gun violence prevention. So I know that you are a big advocate about gun violence and how to deal with prevention. And I just want to know, what is the difference between you and the incumbent when it comes to gun violence?
So I think the biggest difference is that this is my issue. This is my lane. This is something that I talk about all the time because gun violence is a healthcare issue. Because as a doctor, I see the complications of gun violence every day. And, I think that's the big difference, is that this is something that I want to talk about. It's something I want to lead on in Washington. But there are also policy differences. I mean, Representative Lynch, in prior congressional sessions, voted against an assault weapons ban. He voted against holding gun manufacturers liable for deaths that happen in mass shootings. And I think even more broadly, he has not been willing to have the conversation about police reform, about ways that we can decrease gun violence on our streets. He hasn't had this conversation about investing in the right programs. And I think I am eager to go to Washington to lead the conversation about how we make streets safer, decrease violence from guns, make sure that everybody has access to those common sense interventions, things like background checks, closing the boyfriend loophole, making sure that we have had a conversation around licensing for guns. Those are things that we should move forward with because so many people support them. And I don't see the congressman in Washington having that conversation. And I certainly don't see him leading on those issues at all.
So you're talking about, I'm sorry if I'm monopolized on the questions. So you're talking about he's voting against the gun reform. And do you think there's a generational gap between you and Congressman Lynch? That's why certain things that you see, we as the millennium and they see as a need and a necessity, but he said as something that should stay the way that it is. So do you think that's why we cannot move forward a few bills in the Senate because of that gap?
I do think that there's a generational issue here. I mean, I grew up and went to school at the time of Columbine. I had gun violence drills in middle school and in high school. I have watched these violent mass shootings happen, and it feels very real to me in many ways. But it's not just those mass shootings that influence my decisions and my thoughts around gun violence. I'm fully aware that while that captures the nation's attention when it comes to the news media, that's not the vast majority of deaths and violent acts that happen from guns. 40% of deaths are suicides, and that's a crisis of mental health in this country. A tremendous amount of the violence and deaths are in the Black and brown communities all across the country, and certainly all across Massachusetts. And those aren't being talked about in the media, and those aren't being talked about in the newspaper. So I think there is a piece of this that is generational. I've lived it and experienced it. But there's also a piece of this is that I'm willing to have this much bigger conversation about what gun violence means in America. And I'm not sure that the congressman even understands that there's a broader conversation to have.
True that. And I think that will be great that we need to focus on that, because that issue has been affecting us. When I mean us, mostly people of color, because of the systemic racism that's happening in this society. So we are the most, the victim of gun violence in all levels. So as if I said that if you are elected as congressman, so what is your thought in regard of fighting to end systemic racism in the United States?
Yeah. So I will say there is no one bill that can end systemic racism, right? And we're starting to push forward with bills that are addressing systemic racism. Mm-hmm. The George Floyd Justice and Policing Act was an amazing start to look at the racism in our criminal legal system. The push by Congresswoman Presley and Senator Warren to end qualified immunity is a start to address racism that exists in the criminal legal system. But I truly believe until we recognize that there is racism in every aspect of our society, we will never be able to address it. We have to recognize that our housing policies are racist. Yeah. Our education policy is racist. Our healthcare system is racist. Everything. Our transportation system, everything. And so the way that we address this is not by one bill that magically corrects racism that has existed for centuries. The way we correct this is that every bill that comes out of Washington, whether it be a housing bill, a transportation bill, a healthcare bill, or a police reform bill, specifically, explicitly, intentionally talks about race and talks about the ways that we are going to reverse the racism that exists and move forward into an anti-racist future as a country.
All right. So Maria, I will let you chime in. So.
Thank you. I'm taking it all in, and thank you, Robbie, for again joining us and just enlightening us with the many ideas that you have when you get up there to Washington, hopefully soon. On the same path that you might as well get there, because Marlene went there and you started opening that. So my interest in asking you is about racial equity and disparities as it's involved in education. So maybe more so, what role do you play in eliminating racial disparities and maybe your personal investments that you have for Congress in terms of the learning options and what's out there in education for especially Black and brown kids and youths?
Yeah, so this spans the entire spectrum, right? This starts when kids are incredibly young and goes all the way through college education. And there are racial inequities all the way through. When we think about child care and pre-K, that disproportionately is impacting Black and brown women who are making far less than white women and certainly far less than men in this country and are unable to afford the child care that they need to make sure that their kids can start school on an even playing field with everyone else. And so we've got to make sure that we have access to universal child care and universal pre-K all across the country. And that education, that early childhood education, reflects the communities where people are living. So it should provide jobs for people in those communities. It should make sure that it's teaching about local history and bringing people into their community and their culture, right? It's an opportunity to build up communities and get people ready for the next step. And then once they get into the K-12 education system, there's a lot of work to do, right? We're talking a lot about anti-racism curriculum, and I think that's important because it's going to help broadly. But what's going to help even more is that we invest in Black and brown teachers, and we make sure that we have Black and brown teachers in schools all across this country, right? Because they're going to be able to teach people what it really means to be anti-racist. They're going to be able to teach people how to move forward. And, and the goal is that all of those kids are going to move on and go to college or go to some other education after high school. And we've got to make sure that everybody can access that. That means a college education, a public education for everybody in this country as a guaranteed right. But I'll also say that college is not right for everyone. Some people, a community college is right. Some people, vocational school, some people, an apprenticeship. And we should make sure that everyone has access to that. When we've done that, right, when we've lifted everybody up in their early childhood education, we've given them the best preparation that they can get from K through 12, and then we give them the tools to move forward with a career, then we'll be able to address the inequity that exists. But we've got to do it all together.
Thank you. You touched on actually another part of my question, which you did answer, just again, in terms of preparation and the fairness, starting from pre-K all the way through high school and possibly on to higher ed. So thanks for answering that too. I guess maybe my last question in terms of education, because I'm sure we can talk about education all night, and that's unfair to the other hosts who have questions. But again, since March, the schools have been closed. They've been closed in Massachusetts. They've been closed all over the country. Of course, the South school systems and timeframes are different. What do you say in terms of the health crisis as a physician in your assessment of education and returning back to school safely? How do you see that, and what role do you see your role in how students can return safely back?
Yeah. So I do think that we can do this safely. I really do. I think that if we invest in the protective equipment, we can return safely. If we listen to the data, we can return safely. But I also think that we certainly have to focus on safety. We've got to make sure, right, the educators, the nurses, the students, the families, everyone is safe. But we also have to remember that the goal is that we're providing people a high quality education. So let's also invest in that. And if it turns out that the safest way to do that is with virtual learning, then let's make sure we have really high quality virtual learning that's accessible to everyone. Let's make sure that there's nobody in this country who isn't able to access the learning because they don't have access to high-speed internet, or they don't have access to technology, or they don't have access to whatever it may be that allows them to get that high quality education. So we've got to work on both of those, right? Because there will likely come a time this fall when the number of cases increase again, and kids are going to be, if they're in school already, pulled back out of school and go back into virtual learning. So we better invest in it now so that we can make sure people have access to that really great education then.
Okay. With that, do you say that Massachusetts, have they adopted any guidelines set up by the federal government or CDC in terms of those protective measures and being prepared and equipped, ready to reopen safely?
We certainly have a plan here in Massachusetts. The governor came out with a plan, and I think it's a start. It is helpful. It gives some guidance as to what school districts should be prepared to do. What it doesn't do, in my opinion, is it doesn't guarantee the resources to the schools if they need it. It doesn't say, we'll make sure you have the masks you need or you have the disinfectants you need. It doesn't provide for those things that are sort of outside of school. People who might need to take public transportation or taking a bus to get to school, how we make sure that those are safe. And I think in many ways, it puts a little too much of the responsibility on parents and families and not enough on the government. And by that, I mean, it becomes the responsibility of parents to screen their kids and to make sure that they're safe to go to school. It becomes the responsibility of parents to figure out what to do if a test is needed. It's the responsibility of parents to figure out where their kids may go if schools have to shut down for whatever reason. And I think the government has a role there. And certainly Massachusetts, the State House, has a role to make sure that everyone has what they need to get through this crisis.
Thank you. Thank you so much.
I just want to ask one question on that as well. So when we are talking about high-speed internet, so as you know, they said that Xfinity gave during that COVID that free high-speed internet. But believe me, that high-speed internet, you cannot go from here to there because it's so slow. It will take you a day and a half before you can see you can be able to upload one thing. So again, we know that we, the brown people, Black and brown people, are the one that will be left behind. Mm-hmm. And it's shown during March through June, some of those kids are left behind because they cannot access the homework that the teachers assign or the school assign. because of that problem of high-speed internet. So do you think that the federal government or the state should make it to a point that every single family should have high-speed internet as for free, as they should?
Absolutely. I mean, let's look at Brockton as an example, right? Brockton actually has an incredible fiber optic cable that runs underneath it all the way through the city to make sure that people from Boston and down in Rhode Island and Connecticut have the connectivity that they need. And it goes right through Brockton, right? But doesn't provide the folks in Brockton the high-speed internet that they need. Now that, to me, that's wild, right? That's a very simple fix where the federal government can come in, build up the infrastructure, make sure that we're doing it with an equity lens in place and making sure that those people that are getting access are the Black and brown communities and Black and brown neighborhoods all throughout Brockton that are living without high-speed connectivity, and making sure that we're building this framework and this network, right? So that we can build up the communities of Brockton. It's not just helpful in education, right? It's certainly a part of this education plan, but it's also about building the businesses of Brockton, right? Brockton could be an amazing hub for business, but right now there's no resources there for businesses to take advantage of. And we can provide those resources with federal investment. We'll build up Brockton into an amazing city, right? In a hub of information technology and biotechnology and so much.
So Robbie, so if my understanding, so if you elected, is that a promise that you will make to Brockton to help us get those benefits, get those, the broadband, because in Brockton we only have Comcast, competition.
Yes.
So again, we in Brockton want people to be an advocate for us.
Yes.
So because at the end of the day, our community is suffering. It's suffering because of lack of leadership, it's lack of resources. So if I understand you right, is that a promise that you make to the resident, to the constituent of Brockton, so you will be that advocate for them if you elected to the 8th congressional district?
Absolutely, every single day. The people of Brockton deserve a representative in Washington who listens to them and works for them, advocates for them, builds them up every single day. Broadband internet is just one of those. High-speed internet is just one of those issues, right? There's so much more. And we could talk about transportation in Brockton. How do we make sure that folks can get in and out of Brockton and can get wherever they need to go so that they can access all these amazing jobs that exist in the greater Boston area? You can't do that if you can't leave Brockton because there's no train that comes in and out. There's no way to get yourself transported. So absolutely, I will go to Washington and advocate every single day for the communities of Brockton.
So what would you say to the establishment that will say, well, you know what, you are a newcomer, so therefore we're gonna lose some seniority, we're gonna lose some leadership. So if we elected a Robbie to be our next congressman, so what would you say to those people?
Well, at first I'd say, what has your seniority in your representative what has actually delivered for you? Over the past 19 years, I don't see that Brockton has been able to really benefit from someone with some seniority down in Washington. Seniority only goes so far if you use it. You've got to be able to actually move forward with policies and proposals, actually get other people to join you and advocate for what you think is right. Congressman Lynch has been there for 19 years, and he certainly doesn't have seniority within the Democratic Party, unlike so many other folks in the Massachusetts delegation. He's not the chair of any major committee like we have in so many other folks in the Massachusetts delegation. And I haven't seen him produce bills or produce legislation that has actually benefited folks all across the district. But the other thing I'll say is that, I hear this argument a lot, and I point to the district just next to us, which is the 7th Congressional District, where Ayanna Pressley took on an entrenched incumbent in 2018 and won. And I think anyone would agree that Ayanna Pressley has been able to use her first term in Washington to achieve so much for the people of her district and of her community. And that's not because of her seniority. but it's because she does what I would want to do in Washington every day, which is fight for what is right and what is smart and what builds up the communities of the district. It's not about going to Washington to just believe in the status quo and keep pushing forward with the policies of the past. It's about going to Washington and to bring the voices of the district with you.
All right, Dr. Goldstein, I think I want to move on along with some short questions and short answers, if you don't mind. But you have
Not at all. We're having too much fun in the conversation.
I know.
You have stated something earlier, which is very interesting. 19 years in office, and it hasn't really made any difference. Oh boy.
We lost the audio.
We lost our host.
Okay.
All right. So
back to the conversation.
No. Let's ask him the short questions. Remember?
Well, there's no short questions really.
From two women, right?
We like to talk. How's that?
Totally fine. I'm here to talk with you.
Robbie, so let's jump to healthcare. So if I was reading on one of your article, I think you had an interview where you said that Congressman Lynch did not, he voted against the Affordable Care Act. So do you think that he voted at the time because of the fact that he had in front of him? So if he has to do it today, will it do different? Probably he might vote different. So what is your opinion on that?
Well, I think in 2010, when the Affordable Care Act was in front of Congress, it was the largest healthcare expansion our country had seen in over 50 years, since Medicare and Medicaid. And Congressman Lynch had the same data, the same facts, the same evidence as everyone else in Washington, all of the other Democrats. And yet he wasn't willing to vote for that monumental piece of legislation that expanded access. Now, we are 10 years past the Affordable Care Act. We are now at a different stage in this conversation. And I think the conversation is, what do we do next, right? The Affordable Care Act was great, but we still have lack of access in this country. We still have a cost problem. We still have an equity problem in this country. And what's the next step to address those? What I don't see the congressman doing is, I don't see him talking about what his proposal is, how we can make healthcare better, how we can strengthen the system, how we can address cost and equity. I'm out there every day talking about it because I think it is an important fight to fight. But what I don't see is him even suggesting how we're going to address this issue.
Well, again, so I can say that I'm just playing the devil advocate. So he might say, well, you know what? So I will jump on someone else's bill and be healthcare for all. So he might be supporting that.
I guess my response to that would be, I think that this district deserves a leader and not a follower when it comes to healthcare. I think that this district deserves someone who's going to go out and propose what is right for the people of Brockton and the people of Quincy and the people of Boston, and really advocate and fight for that, not just jump on board with somebody else.
So I know you have a bold idea. So as when it comes to healthcare, so because that's in your blood, it's in your vein. So that's what you do every day. So having said that, so with the healthcare for all, so how are we gonna try to pay for that?
Yeah.
How?
So what you're getting at, right, is that I firmly believe that in order to address those issues I talked about before, access, cost, and equity in our healthcare system, we've got to move forward with a single payer healthcare. Single payer healthcare allows healthcare for everyone in this country. And I truly believe, I believe the data, I believe the evidence, that it's going to be able to control the cost of healthcare. So the question really for me is not how expensive is it going to be, but how much money are we going to save in the long run? Because right now we're spending trillions of dollars a year on healthcare. We can't afford to do that anymore. We've got to bend that curve back down, spend less and less each year. There's certainly going to be an investment upfront. We're going to have to pay a little bit in to reap the rewards later. And the benefit that they're paying in right now, that's going to come in repealing the tax cuts of the Trump administration over the past 3.5 years. That's going to come by making sure we close the tax loopholes that corporations and incredibly wealthy Americans benefit from. It's going to be felt by the top 1% of this country and going to provide benefit to 100% of this country. And I think it's the way we have to move forward so that we can actually realize that healthcare is a human right. Everybody in this country deserves access to healthcare.
Yeah. So we have a host back.
Welcome back.
I had to face a very difficult technical glitch of a blackout. So, but anyhow, sir, let's see if we can run with these as fast as we can. Do you support the BML movement, and in what ways will you support racial justice locally?
Yes, so absolutely, I support.
These are going to be just 1 minute answers. So let's move along them fast. Okay, go ahead.
Okay. Perfect. So yes, I support Black Lives Matter. And as we talked about, I think it's about being intentional and explicit in our anti-racism and addressing racism in every policy that comes out of Washington and out of the State House.
Looking at surveys responses from the BIC Mutual Aid Questionnaire, we see an issue with food insecurity in Brockton. And the victims are none other than people of color. What is your proposal to address this to make sure families are adequately fed, which is, as a doctor, you'd understand that's the first need of somebody's survivalship.
Yes. So food security is healthcare. You can't be healthy if you don't have enough food. We've got to make sure that we use our healthcare system appropriately to guarantee people access to the food that they need. It's going to take investment from the federal government. It's going to take investment in community programs. But until we recognize that food security and healthcare are inextricably linked, we're not going to be able to move forward with the solutions.
All right, as quickly as possible, giving the rent moratorium. Many people, for many reasons, have not been able to pay for their rent. And the government is not willing to be giving them any money either. What do you propose to bring families and landlords relief?
Yeah, well, let's fix both of those problems. Let's extend the eviction moratorium and extend benefits to renters all across this country, which we should do for the extent of this entire crisis. And let's also pass an emergency cash relief bill, which will allow people the money they need during this crisis to pay for rent and groceries and medical care and so many other aspects of their life.
4 quick ones. And the Brockton Enterprise, it's recently stated that Brockton rents are among the highest in the nation. Why is that, and what do you propose as a remedy to this problem?
So short answer, it's because of racism that the rents are so high and the amount that people bring home every day in their paycheck is too low. So we've got to address that at the root cause. But then we've also got to invest in affordable housing all across the country, but certainly in Brockton. That's a federal investment, a state investment, and a municipal investment to make sure there's enough housing supply so that we can drive down the overall cost of rents for everyone.
Well, can we, when it comes to rent, so there were some legislation that they were putting, I believe it was in January or February, regarding rent control. So what is your thought on that, about the rent control legislation?
Yeah, so, I think rent control is one way that we can address the rising cost of rents year after year in places like Brockton, in places like Boston, in places like Quincy, where rents are increasing exponentially and wages are staying stagnant. So I think it's certainly something that we need to put on the table. But I think more importantly, we have to have a conversation around supply, because there's not enough affordable housing in all of these communities. And that's because the federal government has had its hands tied behind its back for much of the past few decades and hasn't been able to invest in affordable housing. So if you have limited supply and a ton of demand, of course, the costs are going to go up. And we can fix that by simply increasing the overall supply.
Well, listen, with COVID-19, certainly we have way more homeless right now than ever before, whether if it's Boston, whether if it's anywhere in the United States. How will you support the issue of homeless in Massachusetts, per se?
Yeah, so this is linked to housing, right? So many people are homeless because they can't afford their rents and they don't have affordable housing. But it's also linked to healthcare. It's linked to the fact that we don't have enough mental health services across this country and here in Massachusetts. And so many people, instead of being cared for by a health provider or mental health provider, they are on the streets and homeless. It's also linked to our substance use epidemic all across Massachusetts and across the country. So we've got to invest in all of those, right? Invest in housing, invest in mental health services, and invest in substance use and harm reduction strategies, so that we can comprehensively deal with those that are experiencing homelessness in our communities and all across the country.
I have a very odd question for you, and this is part of my philosophy of life, okay? United States happens to be the richest country in the world. Okay, we have the 1%ers who really holding on to all of the money of this planet Earth, to be perfect. How do we reach out to the consciousness of this 1% to really help tell them that it's time that they change this world and stop being so selfish with the 99%?
Yeah. Well, I'll say two things. One is that we have to show them why it's smart to do this. We all know it's right to invest in healthcare and housing and the environment and to invest in the 99%. It's the right thing to do, but it's also smart. And the reason it's smart is that none of those people became wealthy on their own. None of those people were able to amass their wealth either in this generation or in prior generations without the work, the effort, the engagement of the 99% of the American workers all across this country. When we invest in America, when we invest in the 99%, we are going to bring the entire country forward. And so we've got to reach out to those that are in the 1% and share with them that they have an opportunity to do the right thing and to do a really smart thing and bring them on board with our cause.
Robbie, so can we switch a little bit to COVID-19? So how do you feel that the federal government is handled the COVID-19?
You know, the federal government, just like the number of cases, has gone in waves in its response to COVID-19. I think certainly we saw in the beginning that there were some disastrous handling of the COVID-19 crisis. We didn't have enough PPE, we didn't have enough testing, we didn't have a president who believed that this was actually a crisis and thought that it was going to go away. I think as states, certainly Massachusetts, began to take over some of that responsibility, we saw us be able to control the crisis, bend the curve, right, flatten the curve, so that we had less of attacks on our healthcare institutions. But what I'm nervous about is that we are now seeing a return of that mishandling that we saw so clearly at the beginning of this crisis. We have a president who still, after months, is advocating for the use of a medication that has no proven benefit and only causes harm. We have folks in the federal government who are refusing to fund what we need for testing because they don't want to see more numbers show up on the spreadsheets. We have a federal government that is really throwing its hands up and abdicating its responsibility in providing the PPE we need all across the country. I think that the federal government has really, in many ways, prevented us as a nation from getting through this crisis. And you know, today it was a really somber milestone. We passed 150,000 people in this country who have died from COVID-19. Each and every single one of those deaths should be weighing on the mind of the president and everyone in the president's administration. And there should be a recognition that so many of those deaths were preventable and avoidable. And if we had simply invested in the beginning and believed in science and data, we could have had a much different outcome in this crisis.
So what about the members of Congress? How would you score them, and particularly your opponent?
Well, you know, I think Congress is partially to blame for what has happened. It's been 4 months since we've passed any stimulus package. It's been 4 months since we have talked about evictions and rents and emergency cash relief. And that is because Congress, on both sides of the aisle, has not been forceful enough in pushing forward the policies that we need. But, you know, I think in particular, one of the things I point out with Congressman Lynch is that he, for much of his time in Congress, has sat on the House Oversight Committee and has had the opportunity to provide oversight to the federal government, watched as the federal government removed funding from the National Security Council, from CDC, from the NIH. He watched as we became less prepared as a nation and didn't say anything about it, didn't stand up and say, we need to fix this until after the crisis already hit. And that absence of oversight before left us unprepared during the entire pandemic.
Any other questions for you?
Yes, I do. What innovative solutions proposal do you propose to engage young people in employment, the arts, and voter engagement, especially during this time right now?
Yeah, so we have made it a mission of the campaign to engage young people because we know young people are eager to see change in Washington. They're eager to make sure that their issues, gun violence, the environment, college education, that all of those are a part of the conversation in Washington. So we are meeting them where they are. We're meeting them online, on social media. We're meeting them at their community events and their groups. We are trying to bring them into the campaign because their voices are so important. And so much of the fight is about the issues that they care about so deeply.
So what about diversity? How you plan to integrate minority in your campaign, and also if you become if you elected, so how the composition of your cabinet will be?
So my campaign, just like my congressional office would be, and just like the transgender health program is that I built at Mass General Hospital and the work I do in the hospital, just like all of those places, it is about diverse voices. It's about bringing in people who can bring their life experience and can add to the conversation and can drive us in the right direction. So it is incredibly important to me that the office I would have in Washington has voices of people from the communities all across the 8th district, has people of all genders, people of all races, people who speak different languages, people who came from different countries, people who are going to bring with them a lived experience that I don't have, but a lived experience that is incredibly important to making sure we're making the right decisions.
Stefan?
That's great. We'll be watching.
Hold me accountable.
We will.
Yeah.
I think Marlene knows we will be watching, right? Sometimes, we hear things in the campaign trail, and I think we all on the board here can appreciate that. And sometimes we don't see it come into fruition. So I think will be wonderful to see that.
Yeah.
Well, as a doctor, what do you see as the future of Medicaid?
I believe that we're going to move to a single-payer healthcare system. I believe that that is the only way forward for this country in order to control the cost of healthcare, to guarantee access in healthcare, and to make sure that everyone has access, right? That we're equitable in the healthcare that we're delivering. It's going to take us time. It's not happening at the snap of a finger, but we will get there because it's the right way to go.
So,
go ahead, Mark.
So what would you do? What would you do to narrow the gap in access to care if you have a chance to go in healthcare?
So there are policies that, frankly, I believe we should pass right now, but likely won't get passed until January 2021 when we have a new Congress and a new president. Expanding Medicaid in all 50 states will immediately improve access all across the country and, importantly, improve access for Black and Brown communities who are disproportionately impacted by the Medicaid decisions that certain states have made. Lowering the age to get on Medicare will increase the number of folks who can get onto Medicare and can decouple insurance from employment, which will make everyone able to have a job that they are happy with, right? And not stay in a job simply because it provides them healthcare at a time when they may need healthcare. And I think that there are real changes that we can make to our drug development process through the Food and Drug Administration that allows for regulation of drug prices. And all of that can happen even before we get to a single payer system. So we're going to fight for those things while we are still fighting to move forward with the single payer system.
So the irony is, so if it was January, so we will talk about the opioid crisis. So now, what COVID-19 take precedent over the opioid crisis. So again, we have to talk about it regardless it's COVID-19, because people in the communities continue to be affected by the opioid crisis. Absolutely. Because now it's more dire because they are in isolation. So what is your plan and your thought on how to address the opioid crisis in Washington?
Yeah, so you're right, it continues to exist through this pandemic. And in many ways, actually, it is much worse through this pandemic because people are isolated. People don't have access to the same services they had before. My solution to the opioid crisis is what works, which is harm reduction. There are so many programs out there that work, and we've pioneered many of them here in Massachusetts. Needle exchange programs, counseling for those that require it. Hopefully safe consumption sites where people can have supervised consumption and can make sure that they get access to what they need. All of these harm reduction strategies, they're really addressing the fact that people need to be linked in. People need to be linked in to care. They need to be linked in to substance use counseling. When we link them in, we can help address what is a medical issue, addiction, make sure they have what they need to hopefully be safe, right? Decrease overdose deaths, decrease the infectious complications, and address some of that underlying mental health concerns that exist.
So Robbie, you know what? I don't know, maybe, so when we talk about healthcare, we spend a lot of money in intervention. So, but there's a lot of studies that show prevention is the key. So, what is your plan? So, as a doctor, so
I'm a primary care doctor. I believe in prevention.
we need more doctors in Congress so that can bring their common sense and drive laws, legislation that can help us and save lives and save costs. What is the plan when it comes to healthcare? When it comes to prevention?
So I'm a primary care doc. I believe in prevention. I believe an ounce of prevention is worth a pound of treatment.
There you go.
And we can do that by adjusting the way that we pay for care in this country. Right now, we pay for treatment. And so it's not a surprise that we have more treatments happening than prevention. Instead, we can incentivize people to have access to primary care docs and nurse practitioners, to weight counseling and coaches to help deal with the diabetes epidemic that we see, to make sure that people have access to the mental health care that they need to help prevent anything that may happen in the future. Prevention is incredibly important, but we don't pay for it. So nobody does it. We've got to change the whole system so that we are prioritizing the prevention pieces so that we don't need the treatment part.
Yeah, thank you.
I think time is of an essence right now, since we were only on for about an hour and we're approaching to the end. We will give you a final questions together with your closing statement so that we can wrap this up. This country spent trillions on healthcare and zero on health prevention. Every study shows that health preventions can help reduce costs. Answer that questions for us as fast as you can, and also your closing remarks as well.
Yeah, right. So, I mean, and that's what I was just talking about, is this idea. I'm a primary care doctor, and I believe in prevention. I believe strongly in the idea that if we invest now, we can make a better future for everyone and a healthier future for everyone. As Marlene said, I will say, we need more doctors in Congress, because we need people who believe in that idea, people who truly know the power of prevention and know the power of using data and evidence, as you were talking about, to drive our decisions and our policy. So I got into this race because I think that this district is ready for someone who will bring that perspective, someone who will bring evidence with him to Washington to make the right decisions and the smart decisions for communities all across the district. And that includes everyone living in Brockton.
Marlene, thank you so very much for your contributions. Maria as well. And NCTV, Robbie, our guest, Goldstein, we wish you the best of luck. We hope that you don't change when you get to Washington, that you honor your words and you stand by it, because that's the only way the constituent will stand by you. We wish you best of luck, and thank you so very much.
Thank you, everyone. This was such a fun night for me, so I appreciate it.
Robbie, if someone wants to reach out to you, what is the website?
The best way to reach me is robbieforchange.com, ROBBIEFOR change.com.
Thank you.
Thank you, Robbie. Good luck.
Thank you. Good luck.
You.
Thanks.
Good night, everyone.
Good night.
Bye-bye.